Well, I'm Sally Bell. I'm age 70 and I live in Parklands Row in Sketty. 3 years ago, I went on holidays to Tenerife. Coming back on Boxing Day, I collapsed on the plane and then I was transferred straight to Morrison Hospital. Well, I was in for 3 weeks in intensive care. I wasn't able to move or talk or do anything. But with the helpful care that I've had from the unit, I'm now alive and kicking and living a good life. I live with my handicapped daughter, who was a great help to me.
I helped my mum to get dressed and I make sure she's alright, and she's a really lovely mum.
Kath and I wake up at 5. We get up at 15:15 and then she helps me to dress. So when I come down here, I've got all my equipment ready and my creams and my tablets and everything is done for me. And without her, I wouldn't be able to manage. She answers the door and she makes sure I got the right ambulance man. She gets all my equipment ready to give to the ambulance man and they all acknowledge her. Ambulance drivers picks us up from anything from 6:20 to 6:30. Monday, Wednesday and Friday, sometimes on a Saturday. And I'm on for 4 hours. For the first couple of months we had a lovely car. And there were 3 of us driving and we got to know the driver very, very well. And since then we've had various transports, mostly the ambulances. They're not an easy ride. But I'm grateful for the transport, which is free. They are very, very supportive and they usually drop us straight outside the house, always see me up the drive and they always make sure that I'm in safe and sound. But they could be a little better, as I said, on the outward bound journeys. I think if they looked into that and looked at the routes that they've got to pick the patients up in, that I think we would feel a lot happier. I know we've got social services as well helping us, but they pick up a lot of patients before they come to pick us up. And I think that's the link. Because if they're picking patients up at 12 o'clock, it could be in Pennard, it could be in anywhere. So as a result then we are picked up a lot later. And we're quite unwell sometimes and we don't feel like waiting. Or we feel sick. Could be more people on the ambulance so we got a longer journey, or I could be on my own.
Make sure she don't go on very long journeys on the way home because she gets very dizzy and really sick. To prefer the ambulance car to an ambulance. I tell my mum when she got to get across, whatever time she comes, phone my mobile and I go outside waiting. I feel if I worry and then because anything could happen to mum.
They apologising profusely, but it's not their fault. If they go to see a patient and they're not ready or they've got to help them out, they've got to do it. Hence for them related. So what I think is that the ambulance drivers who take us should bring us home.